Thank you. So I'm Ben, as they mentioned. I'm going to borrow your mind a little bit, take you outside US. Um, our work is about investigating differences in drinking water quality among surface water sources, public taps, and household water storage containers in rural communities in Rwanda. So this is a very small, tiny country and also known as a country of 1,000 hills. So this work, working with Dr. Snow and Malachi and fellow student Owase. So child stunting is one of the form of malnutrition that is a global health problem. And Rwanda levels are still high. And this is a multifactorial problem which is influenced by family, socioeconomic, and environmental risk factors, including zoonotic pathogenic exposure and water quality. And One Health approach can help to link and understand complex factors and also help in shaping future interventions. So this picture demonstrates how humans, animals, and environment are closely interlinked and how their connections can easily promote pathogen sharing and leading to public health issues. So our project goal is to mainly evaluate the physical and chemical factors influencing water quality in drinking water sources in our area of interest, which is western part of the country, that's Karongi district. And the next goal is to investigate the potential pathogen sharing at the livestock-human interface. So our main sample sources, there are three main sources we are interested in at household level. We're also interested in surface water and also public taps. So these are the main sources that people in this area use for domestic purposes, including cooking, washing, and drinking. So the methods we use, we used the portable meter to test basic water quality measurements, such as pH and TDS, temperature, and others. And the samples we collected were shipped to Nebraska Water Science Lab for further testing, mainly for the major anions and heavy metals. And we did the fecal and water samples culture in University of Rwanda lab to test for the three main pathogenic bacteria of interest. And these bacteria, for your information, they can cause public health issues both in humans and animals. So they can infect both humans and animals. Campylobacter, it causes campylobacterosis, and this is a very serious issue, mainly in children below the age of 5. E. coli and Salmonella, and there are reservoirs in livestock. So our preliminary results show that from water samples, iron and manganese exceed the recommended levels across the different three types of water sources I mentioned above. And there is high coliform bacteria levels detected mainly in surface water with around 53.3%. And the household samples were also contaminated with around 20% of coliform bacteria. So the public taps were safe. We didn't find any indicator for fecal contamination. And with the fecal samples we collected from livestock and households, water sources or samples, 90% of livestock and water samples were positive for E. coli and Campi. Campi, this is a Campylobacter, which leads to campylobacterosis, and mainly children below the age of 5, it causes diarrhea, and also it can also cause implications in livestock. Our recommendation with the results we have at the moment, further investigation is required to understand exactly the sources of the high iron and manganese in the samples we got. And also we are doing further, we want to do the further analysis through DNA genome sequencing from the different isolates we've already got from the three sample sources, which are the surface, public taps, and also household. At the same time, also the livestock from these households we're working with. With that, looking at our results, we have high contamination at household level. We also think it's important to talk about, to develop an outreach program to educate the community with the bacterial contamination, which we found really high in this part of the country. So I want to end this by thanking DWFI for the support, for different support in terms of finance, and also the project partners back in Rwanda, including the lab technicians and the different leadership, the community leaders and households we work with. Thank you.